I have 6 o'clock, so we're going to go ahead and start the county board meeting Thursday, April 15, 2021 meeting to order. I please ask that everybody silence their phones during the meeting. Invocation, we're going to have Pastor Randall come up, and then we're going to have Schaefer lead us in the pledge. Pastor Randall?
Thank you very much. Good evening, Livingston County board members. Thank you for the opportunity to pray over you this evening and to pray for our county, and just thank you for your service to each one of us. And so, God, we come before you this evening, and more each day we recognize our great need for your presence, your love, and your power to be evident in our lives, in our families, in our communities, in this great state of Illinois, our nation, and our world. Lord, you said in your word in Jeremiah 29:11, you know the plans that you have for us, and they are plans for good and not for disaster, to give us a future and a hope. God, we are asking for you to give us understanding for the times that we live in, wisdom on how to live as we move forward as a nation, and have mercy upon us as we recover from this pandemic in all the ways that it has affected us. Bless the individuals and the families that have been impacted most by this virus. Restore people's finances, our businesses, and overall economy. Encourage the people of Livingston County. Help those who are struggling with stress, depression, those that are overwhelmed, turning maybe to addiction or even contemplating suicide. God, we just pray that you would help our nation and have compassion upon us as we deal with racial issues, mass shootings, and violence. Bring peace to the streets of America once again. And Lord, we hold to you and your promises of a good plan, a blessed and prosperous future, and a hope of greater days for us, our children, and our grandbabies. We do not look to the right or to the left, or even in ourselves, but you said that if we would seek first the kingdom of God, everything else would be added unto us. So tonight, impart your wisdom and discernment to these men and women who are giving of their time and their talents to lead Livingston County into a brighter future, into a greater hope. God bless us. God bless Livingston County. God bless our world. And God bless America. Amen.
Amen. God bless you, Pastor Randall. Thank you. Please stand and face the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Tim. Before we get rolling on roll call here, I have been informed that there's 2 birthdays in this room tonight, our very own Christy and our very own Marty. So before we get started, please, everybody keep your microphones muted because I don't want to hear you all sing, but let's sing them happy birthday.
Happy birthday to you.
Oh, boy. Very good.
Happy birthday, both of you. Now with roll call, Christy.
Vietti. Bunning.
Present.
Kirkton.
Here.
Manker. Here. Berrickman. Slagle.
Here.
Fannin. Steichen. Schaefer.
Here.
Menninga. Kestner. Welch.
Present.
Carley.
Present.
Weller. Ritter.
Present.
Mays. Lovell.
Here.
Ambrose.
Here.
Blackard. Ehring.
Here.
Bitstam. Arbogast. Wilkie.
Here.
Runyon.
Here.
We have quorum. Before you is the agenda. Are there any additions or corrections?
I'll make a motion to approve the agenda.
It's been moved by Ritter, seconded by Weller. All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We have approval of minutes. We have December 17th. We have January 14th. We have February 11th. We have March 23rd and March 31st.
Jason, is that all as one motion?
We're going to do it all as one motion, Paul. It's been moved by Wilkie,
I'll second it, Ambrose.
seconded by Ambrose. Discussion? All those in favor say aye.
Aye.
Opposed, same sign. Motion carries. We have one presentation tonight, the Public Health Annual Report. Jackie?
Good evening.
Good evening.
I put in front of you, each should have a hard copy of the annual report. On the very first page are listing all of our Board of Health members and our staff. We currently have 30 full and part-time staff members, and the remainder that are listed there are some of our PRN staff that work for us, mostly the nursing staff. On the second page lists the tuberculosis clinic and the use of the tax levy funds for that. The expenditures obviously are down for 2020 because we just didn't have people coming in, getting skin tests and getting tested for anything. So those are a little bit lower this year than they normally would have been. The tax levy is listed below that on the second part of that page. Most of the administrative costs were a lot higher this year, just based on everything that was going on, and that was rather to be expected. On the third page is a breakdown of the financial report. The revenues and the expenditures are both listed there in comparison to 2019 and the 2020. We did have an increase in our tax levy, which we use for the administrative costs. The difference in the grants between the 2 years, there was a pretty large contact tracing grant that we got in 2020, and also a Cure COVID grant that we received that was about $44,000, and between the two of them, that was almost $400,000 of grants. So that's about the difference between those. Fee for services were down significantly, as the EPSDT Medicaid dollars you'll see there between the 2 years, and that's strictly because we didn't have services being done. From March until almost June, we had no clinics going on. WIC, Family Case Management, were about the only two grants that continued actually doing visits via phone. CCU obviously was, our senior services were also being done by phone, but everything else had pretty much stopped for those 3 months, and still have not returned to this to date yet for Family Case Management and WIC. So a lot of those EPSDT are some of our physicals that we do on our children, immunizations, although those we did start back in June doing immunization clinics again for all ages, so that has come back somewhat. Our wellness clinic we had stopped for 3 months, so that's back up and running again also. Family planning was another one that we couldn't do in-house, so those really just being done for 3 months really did affect our numbers. Expenditures, we had an increase in personnel. Operations and contractual was actually down a little bit, as were our travel, obviously, when we're going anywhere. And so that kind of explains a little bit of the expenditures and the differences in what our revenues were from the previous year. We were fortunate, most of our grants held us harmless for 2020. Typically, our grants are based on our patients that we see, our clients that we get. We get paid per client. But this year, they kind of stopped that, understanding what was going on, and that most of our staff was being pulled to do other things. So we did still get the revenue to help pay for staffing so that we didn't lose anybody. But that is the difference in some of the numbers that you'll see on the back page. If you turn over to that, We've listed there what our caseloads are for a lot of these. A couple of the things that really jump out, the family planning numbers from 2019 to 2020, again, were because we didn't have any clinics going on. Women's clinic would have been the same way. WIC, family case management, healthy families, were all seeing patients via phone, so those case numbers actually didn't change a whole lot. Our school-based health center had a little bit of drop in the number of visits that they saw. Hearing and vision, again, we didn't see anybody for about 3 months there, so those numbers were affected. If you look at our wellness numbers, we did not do Vector this year, which is about 800 clients that we see there, so that took a huge hit. Cases reported for coronavirus was obviously brand new this year, so those were up, as were our CD investigations pretty significantly. So those were the big things that I noticed. If you have any questions on anything, I'd be glad to take any of those.
Are there questions for Jackie as it pertains to her annual report?
Mr. Chairman.
Ritter?
Jackie, are any of these numbers reflective of anything that takes place in our schools? Any information as far as checks or that type of a service? So, for example, like we have at Pontiac High School, we have someone there. Does any of that take place in these as well?
Some of our wellness clinics that were held in schools would be reflective in the wellness clinic. Health education was down. Those go into our school health programs and our community programs both. It kind of depends on what the topic is. Some of the STD clinics information, tobacco, all of those have some bearing in schools.
I was just curious.
Yeah, depends on what the topic is. The other thing that took a big hit were the environmental health, because we had to stop doing any kind of food classes, and those are just now starting to come back on board. And of course, none of the inspections were done during all of that time.
Thank you.
Jackie, as I look at this, and in the top left there on WIC, we've got a 70 active case increase from 19 to 2020. Would any of that be COVID related?
No, actually, that's a change in caseload that the state gives us each year.
Okay.
They assign us a caseload, and then we work towards that. So that really had no bearings on 2020.
Super. Any other questions for Jackie? Entertain a motion to approve the public health annual report. Been moved by Kessler. Is there a second? Seconded by Earing here. Sorry, Paul, saw him first. Discussion? Roll call, please.
Fieri. Yes. Bunning.
Yes.
Kirkton.
Yes.
Manker. Yes. Barrickman. Slagle.
Yes.
Fannin.
Yes.
Steichen. Schaefer.
Yes.
Menninga. Kestner. Welch.
Yes.
Carly.
Yes.
Weller. Ritter.
Yes.
Mays. Lovell.
Yes.
Ambrose.
Yes.
Blackard. Airing.
Yes.
Fitstum.
Yes.
Arbogast. Wilkie.
Yes.
Runyon.
Yes.
Very well. As we have her here as a captured audience, is there any questions about COVID or vaccinations or anything taking place here in the county? I will say I saw the post on Facebook about the National Guard, and I tell you what, I got just a little bit choked up. That was exciting to see. I'm glad you posted. I'm glad you put it out there for people to see. But that was. Can you talk on that a little bit on how that worked out?
It was probably one of the two best days that I've had recently. It was such an honor to work with them, and it was amazing to see them come in. They asked what we wanted done, and they did it. But it was a wonderful 2 days, and we were really pleased that they were able to come in and help us out. We did probably 1,200 shots between the 2 days.
Very good.
Mr. Chairman?
Seth, oh, I'm sorry.
Well, go ahead.
Seth?
What percentage of the Livingston County population would you say is?
We're close to
vaccinated?
20%.
Okay.
I didn't check it this afternoon, but we should have been. We do all of our second dose clinics on Thursdays, as does OSF, so we should have bumped over the 20% mark.
Mark?
Yeah, I don't have a question, but I did have a comment. I received my vaccination on Tuesday, April 6th at the Pontiac Baptist Church. It went smoothly. Everything was fine. From the time I got out of my vehicle to the time I got back to my vehicle was a total of about 8 minutes. The thing just went smoothly. The shot didn't even hurt. So I want to commend you and all your staff. Fantastic. You've got it organized fantastically, and I would encourage anyone to go ahead and get your shot whenever you can.
Thank you, sir.
All righty, very well. Thank you, Jackie. If there's no other questions. Super.
Thank you.
Okay, moving on the consent agenda. Approval of bills. We've got a few appointments and FY 2021-2022 strategic plan.
Motion to approve by Fannin.
Been moved by Fannin. Is there a second?
By Ritter.
Seconded by Ritter. Discussion? Roll call, please.
Fieri. Bunning.
Yes.
Kirkton.
Yes.
Manker.
Yes.
Berkman. Slagle.
Yes.
Fannin.
Yes.
Steichen. Schaefer.
Yes.
Menninga. Kestner. Welch.
Yes.
Carly.
Yes.
Weller. Ritter.
Yes.
Mays. Lovell.
Yes.
Ambrose.
Yes.
Blackard. Aaron.
Yes.
Fitstum. Arbogast. Wilkie.
Yes.
Runyon.
Yes.
Very well. Moving on to the action agenda. First up, Highway Committee. Mr. Lovell.
Okay, thank you, Mr. Chairman, or Vice Chairman, or Acting Chairman. What we've got tonight is we've got 3 engineering agreements. One is in Nebraska Township, design or replacement of an existing bridge. The next one's in Campus, north of Campus, designed to determine replacement or rehabilitation of an existing bridge. So basically, they're going to evaluate that one. The third one is in Ancona, designed to rehabilitate an existing bridge. So these are 3 engineering agreements, and Clay is here if there's any questions. So, other words, we got any questions?
Questions for Steve or Clay? Been moved by Lovell,
Yep.
Second.
seconded by Runyon. Discussion? Roll call.
Fieri. Bunning.
Yes.
Kirkton.
Yes.
Manker.
Yes.
Berkman. Slagle.
Yes.
Fannin.
Yes.
Steichen. Schaefer.
Yes.
Menninga. Kestner. Welch.
Yes.
Carly.
Yes.
Weller. Ritter.
Yes.
Mays. Lovell.
Yes.
Ambrose.
Yes.
Blackard. Aaron.
Yes.
Fitstum. Arbogast. Wilkie.
Yes.
Runyon.
Yes.
I think that concludes my report for tonight. So, thank you, Clay.
Thank you, Steve. Thank you, Clay.
Thank you.
Very good presentation.
Moving on to public property. John?
Lease a sublease with Project Oz. We've got a lease with them now. I guess it's a matter of renewing it. There is room in the new building for them. So I guess we just need a motion to renew that lease. Can you think of anything to add to that, Alina? I think that pretty well says it, don't it?
I'll make a motion to renew the lease.
Motion by Gina.
Been moved by Gina. Is there a second?
Second.
Seconded by Kirkton. Discussion? Roll call, please, Chrissy.
Fieri. Bunning.
Yes.
Kirkton.
Yes.
Manker.
Yes.
Slagle.
Yes.
Fannin.
Yes.
Schaefer.
Yes.
Kestner. Welch.
Yes.
Carly.
Yes.
Weller. Ritter,
Yes.
Lovell,
Yes.
Ambrose,
Yes.
Airing,
Yes.
Fidston,
Yes.
Wilkie,
Yes.
Runyon.
Yes.
Anything else, John?
Yeah, at a Zoom meeting with the contractors on our new building, we still have a holdup with the NICOR. They are slowly still moving ahead, but NICOR will not let them put the windows in. So without putting windows in and stuff, that makes it hard to drywall and everything else. It could come to a screeching halt pretty soon. They're hoping the roof comes in so they can keep going on that. I can't think of anything else on that. Can you, Lena?
No, I think that pretty well covers it.
Is there a timeline at all? Oh, I'm sorry. Go ahead, John. Is there a timeline on where we're at with NICOR?
That's about like a flip on a coin, I think, when you say that.
They have failed to provide us with any kind of timeline. We don't know if it's days, we don't know if it's months, we have no idea.
What's the substance of that?
So the issue was that, so initially, if you remember correctly, the current existing line is in the footprint. So it needs to be moved over. It cannot
Okay.
remain where it is.
Okay.
As part of that, they were supposed to be doing the engineering for both. They have two different departments. One does existing lines, one handles new services. Well, apparently, those two departments do not communicate at all, so they did not take into consideration the fact that we had a new service going in as well. And then, as part of that, sorry, I lost my train of thought. So they really did not communicate at all. So they had to re-engineer, and they will only put in one line on each address. So we're not allowed to have two lines into the building. So what they will allow us to do is to put in the new line, deactivate or discontinue the secondary line, and then we'll have to put in a temporary service from our building to the new building, or to the old building. So, it will be costly.
Okay.
Is that clear as mud?
Well, it's just, but no commitment on the time.
No commitment on the time at all. We have reached out. There's a member on the GLCEDC that represents NICOR, and so we
Is
have
that
reached
Bernie?
out to him.
Is that Bernie?
Yes.
It is Bernie.
Okay, and Bernie can't do anything?
I don't know yet. I spoke with him on Monday. He was willing to speak with the contractors, and so they were going to reach out to him, which they had. They had not heard back, but I know that he indicated to me he got as much information from me as he possibly could. That way he could do his own internal
Sure.
review before he called them back.
Sure,
So.
okay. Well, he's a good man, so,
He said he would help if he could.
okay.
Gerald?
So is the reason why the windows can't be put in because they want ventilation for
Correct.
when they turn the gas on?
Actually, they really don't even want the roof on there, but they never told us that till after it was where it's at.
Yeah.
And I'm like you, Gerald, we hit that in September, October when they're digging the footings. And somewhere in their communication between repair and, like she said, there's a new service. And I even asked why our architect didn't check into that and why the construction company didn't. And really, they thought the gas plant did it, and to me, somebody dropped the ball somewhere.
So Elena, how soon can we actually shut the gas line off the old building?
So unfortunately, because we did look at this, we did talk about bringing in temporary, converting it to propane, and just converting what we have there. The problem is that the generator, the current generator for the building, which is on, like if there was a power outage, we would need that for all the vaccines and things that we hold at the health department. And so that generator also is scheduled to be at the new building. So even if we converted it, then we'd have to convert it back. You still end up paying a lot of money to do that.
Okay, thank you.
Any other questions for John or Alina? Slagle?
So with the increase in building costs of materials, does that affect this project? Like if the OSB is more expensive, or not OSB, but drywall or whatever, if it's more expensive now, who eats that increase?
They have that, my understanding, they've got that all booked, follow me? So, I mean, I think it's on the, what I want to say, they've got it purchased with as a matter of fact, it could come in, we may have to find a place to put it. That's another expense. I mean,
Yeah.
there's several things that is ordered, if I'm saying this right, to come in stages. If that stuff starts coming in, we may have to find a place or else pay for somebody else to keep it. I mean, this is all, yeah, it's not as nice as we thought.
They're supposed to be giving us estimated costs. They've indicated that the project is already delayed to July 1, where we had a May date before. So every day that we're delayed, that we're waiting on NICOR is another day onto that. There will be an additional cost if we get to a point where they need to shut down. They're supposed to provide that estimated cost, but as of right now, it's about $30,000 a month extra it will cost us as we're waiting on NICOR.
I even volunteered for a dumb farmer to come in and dig that line and hit it, but they didn't go for that.
Continued questions? Other questions? Very well. Moving-
I got one more
Oh,
thing.
I'm sorry, John.
I think you all have a letter from IHR, it's supposed to be in your thing. They're pulling out. It says in there, forget what the date is, August 1st. There's another letter in there explaining why, I guess, or what we had talked to. They had given us some plans for their addition and asked about starting early. It does not look like it was gonna work with what we were doing. And, they were not satisfied with the answer, it looks like, so this is what we got back. They are asking for they said they invested $400,000 in capital improvements. They're asking for some compensation. We never talked about this at our committee meeting, but we want to walk through it, and we're trying to, I didn't think there's no sense of rushing into that, but I thought at least a couple of us on the committee would go through it and report back to what we thought it was like.
Will they give,
Got any other suggestions on that?
will they give you a list of what they've done?
I never asked for that, but I could.
Yeah, I think in order for us to get any type of confirmation on the $400,000, we need to have something done, either in writing or receipts or of some sort, so we kind of know where we're at.
Do we have a lease contract with them to be in that building? Is there a contract?
There is a
Yes.
lease, but the contract, I mean, it's not current, it just says that you're allowed to do that, that they're allowed to be there, they were allowed to build there. There isn't anything that's still ongoing. They pay a monthly rent. There's nothing formal as far as that's concerned for them.
So there's nothing in writing that says if we make these improvements, then we're gonna be recompensed.
Oh, there is an agreement on that, but it does not say that there is any type of reimbursement or anything like that.
It's my understanding they put the building up, right?
They did.
And then basically gave it to us for we have the upkeep on it, right? Or
We
the
do
upkeep?
take care of the upkeep as
Right.
part of their lease agreement with the county, but which is not a lease agreement, it's just a portion of what's there. But yeah. I think what we found in the file, there was an agreement that basically allowed them to build on that site. The board had authorized them to do that, and then as far as a lease agreement, it also outlines that we allow them to use a certain amount of space in our current building. And then, other than that, there's a sheet that shows how the costs are divided. These are the costs, so much is by public health, so much is by mental health, and so much is by HR, and that's really it. It's pretty informal.
As you can see, there is a request. We will further discuss the request, and we will go from here. But as John said, we will walk slow through this process and make sure that not only ourselves, but them are treated fairly, and we'll see how this plays. Anything else, John?
That's all my good news.
Thought maybe you'd end with something good, but we're good. We're good.
I think there's a cloud hanging over there.
A lot of people tell me that my whole life.
Moving on to finance, Mr. Schaefer.
Well, thank you, Mr. Chairman. We have Livingston County's leading realtor, Nikki Meyer, has moved another property. I think it was about $800 worth, Nikki? Okay, and I can't remember which community that was in. Odell?
Dwight.
Dwight? Okay. Just another property sold back for taxes and all that good stuff. Got a buyer, close the sale. I would motion we approve it.
It's been moved by Schaefer. Is there a second?
Second by Ehring.
Seconded by Ehring. Discussion? Oh, I'm sorry, Gina.
I think before we vote to approve that, note that the number is wrong on here. It's, where it says 378, it's 376.
So Gina, you're approving the resolution, and the resolution is correct, not the agenda. There's a typo on the agenda. The resolution is correct.
Resolution is correct?
The resolution is correct.
Good catch, Gina.
Clerk for the title.
Any more discussion? Roll call, please.
Beatty? Bunning?
Yes.
Kirkton?
Yes.
Manker? Yes. Slagle?
Yes.
Fannin?
Yes.
Schaefer?
Yes.
Kestner? Welch?
Yes.
Carly?
Yes.
Weller? Ritter?
Yes.
Lovell?
Yes.
Ambrose?
Yes.
Ehring?
Yes.
Fidstem?
Yes.
Wilkie?
Yes.
Runyon?
Yes.
That's all, sir.
Thank you, Tim. Sheriff, jail, and license. Doc?
I've just got a couple comments. I don't know how many people saw it, but our sheriff did a nice job on Fox. I don't know if anybody saw that. I'm sure somebody did, and he did an excellent job. Department's running very smoothly right now. I'd like to thank Chief Hamilton and the rest of the staff, officers there. We can be thankful with all that's happening in the world today, the way our county is being run by our sheriff's department. They're doing a great job. And they're also doing a good job at the staff at the jail. So I think our COVID is well under control. There's no issues there, according to Stu last time he spoke to us. And I'll just, again, reiterate what I usually say, and that's if you see one of the officers or one of the staff, please tell them thank you for the job they're doing. It's not a very easy job in today's era, as we well know. So that concludes my report. Oh, one other thing. There's some calendars on the back table that they brought in, the sheriff did. If somebody wants them, they're free. Pick them up. Thank you.
Thank you, Mr. Carley. Moving on to Agriculture Zoning Committee, myself. No action items. The only information item I have for you folks tonight is we are planning our electronic recycling date is going to take place on Saturday, June 12th, and we're going to have it out here at the old Kmart parking lot is our intentions. We've got 3 to 4 trucks lined up. We ask that nobody shows up before 9, and when I say that, we're hoping they'll start showing up at 8:30 instead of 7:30. So we're going to run it from 9 till 1 on Saturday, June 12th, at the old Kmart parking lot here, out by Old 66. So that is all that I've got for information items. Moving on to personnel, Mr. Vietti. Thank you, Jack. Election rules and legislation, Mr. Kirkton.
Thank you, Mr. Chairman. Nothing for us to action on tonight. We're continuing to still work on reapportionment for Livingston County as we continue to wait on census data, which we don't have yet, but
we're continuing to plow through it anyway. Of one note, I did testify to a legislative subcommittee last Friday on Zoom. I did a Senate subcommittee 2 weeks ago, and now I did a legislative subcommittee last Friday. Of course, nothing came out of that, as usual. I was the only one testifying in person, 2 written testimonies, and then I was the only in-camera testimony. So, other than that, that's all we have for election rules and legislation.
Thank you much. Moving on to veterans. Ron?
We just wanted to note that Tom Bailey is in his 19th year of service to the Veterans Assistance Commission, which is laudable. He did give us a heads up that if one of the old vans with a tremendous high mileage might need to be replaced in next year's budget. Other than that, the VAC is well within its budget.
Thank you, Mr. Kestner. Information and Technology Committee. Marty?
Thank you, Mr. Chairman. We discussed the H&E building phone and security systems. We made the determination to go with Bennett Systems. It's under $30,000, doesn't need to be bid out, and it will. They are working on that. John, do you want to? I'll gladly hand it over to you.
We're putting the same type system that's in this building and the sheriff's building and the Lodge Justice Center, and they're all going to be tied together so we can use one badge for all the buildings for security. And the locks, all electronic locks, each section is separated so we can secure them differently.
Right,
So,
and then same thing for the phone system.
yep, phone system is going to be the same type system. We can do extension dialing to all the buildings. So, all tied together.
And the only other thing that we discussed was we did talk about streaming the committee meetings, but we don't have the staff or the funds to do that right now, but it's still on the radar. So that's all I have, Mr. Chairman.
Thank you, Marty. Thank you, John. We did not meet for administrative with Kathy's absence here. Moving on to the Livingston County Housing Authority. Mr. Slagle?
Thank you, Mr. Chairman. We did meet a couple times since I've discussed this last, I think, but basically the only interesting thing going on is the Chatsworth disposition issue. The HUD says that without a letter from the county or from the city of Chatsworth, village of Chatsworth, they will not allow the disposition of the properties to commence. So at this point, trying to get everybody sat down and talking, and I think it's all solvable if everybody gets on the same page. So, and then I guess there's something about high-speed internet through the high school at some of the buildings. I don't know if Paul knows anything about that, but that's pretty interesting. So they're continuing to pursue that, and that's my report.
Thank you, John.
Out of curiosity, John, what, like, if the parties sit down, what would the likely resolution be?
I think really the people need the housing authority will have to convince the mayor that it's actually in their interest for them to sell it. Perhaps I think they might be able to sell. There's 3 properties over there. They might be able to do it piecemeal, do one at a time, like whichever one the city would be okay with them. Because some of the properties are really could be sold to a private buyer with no problems. It's just more the ones that are sort of the self-contained island communities that are more of a problem. But they could zone it, if the city zoned it so that they could make zoning on that area for anything they want to enforce. So there are solutions, it just needs to be discussed.
Any other questions for John? Okay, moving on to the Mid-Central Community Action. Mr. Wilkie?
Thank you, Chairman. I really don't have anything to report. Our executive director is in the hospital with COVID, and we've been struggling to get around that, so at the moment I do not have anything to update with.
Okay, thank you, Bill. Board of Health, no Joe. Mental Health Board, Jack, anything?
Next meeting is May 20th.
May 20th at 4 p.m. All righty. I'm going to ask that we move into executive session for 5 ILCS 12002, semi-annual review of executive session minutes. Been moved by Wilkie. Is there a second? Seconded by Kirkton. Discussion? Roll call, please. Christie?
Beatty. Bunning.
Yes.
Kirkton.
Yes.
Manker. Yes. Berkman. Slagle.
Yes.
Fannin.
Yes.
Schaefer.
Yes.
Kestner. Seth. Welch.
Yes.
Sorry.
I've been called worse, thank you.
Carly.
Yes.
Weller. Ritter.
Yes.
Lovell.
Yes.
Ambrose.
Yes.
Aaron.
Yes.
Fitstum.
That's what happens when you get old, you forget that.
Okay. Arbogast. Wilkie.
Yes.
And Runyon.
Yes, I guess.
Okay, give us a few minutes to get set up here and we'll get